Happy Thursday.
Happy Thursday. How's it going?
It's much better week this week.
Hmm.
Still chaos. A
Yeah,
lot of unfortunate things brought into my awareness. But all in all, on a more optimistic side of life.
I love it.
Yeah.
Yeah, I feel like where we left off last week was, I think there wasn't a feeling, there was a lot there was some optimism, but there was also a lot of feeling of disillusionment, disappointment. And I really wanted to use today to bookend that conversation and just talk through
Yeah.
what it felt and looked like for you.
Yeah, I appreciate that, honestly. Honestly, I will say that disappointment with our healthcare system, um, that's just gotten increased.
Awesome.
Yeah, and it's unfortunate because so just for an update for everybody else, while my mom was going through all of this, my dad ended up in the hospital. Like as my mom came out, my dad ended up in the hospital due to his COPD. Now, there is an aspect, love my dad, but he has COPD and he smoked cigarettes while my mom was in the hospital to cope with that. Not the best hand in hand. So he kind of got himself there. But also he was on life support. Um, and during this time, it really brought so much awareness to me. The nurses doing phenomenal, honestly. I don't think there was a single nurse between my mom and my dad that I could say, even though I could tell visibly very overworked, um, that they didn't do the best they could and they didn't want to take care of the patients.
Hmm.
Overworked though, like literally, there are times where there's just one nurse on the entire unit. And when you talk to them, they're still loving and caring, but it's like, and I know this is not just a Kaiser issue, this is all around our healthcare system. Doctors, the same. Like my dad needed to switch to tracheostomy. They need to do the surgery, but they couldn't book the surgery for another 2 weeks because there was no time. But also he's like an emergency case. So an emergency case can't get booked for 2 weeks. And it's so frustrating to realize there's so many things. Like as I was standing there and they were talking to me, and of course I'm like just talking to all the nurses and all the doctors and as many people as I can. And the other thing that really brought to my awareness where I was like, dude, that no one's actually doing the practice is that they were like, yeah, when you come in, and we have this, like when I was the clinical director of resilience, they were trying to implement this in our assessment of like having the computer ask the question, tell you what questions to ask to lead to the treatment plan or the diagnosis, which is helpful. And it's time, it takes away from time, like it gives you more time. But the reason I didn't even put in resilience is because it takes away from your ability to think,
Yeah.
do the assessment yourself and ask all the questions. You like practice the thing that you're supposed to do, which is your job, and you're just letting a computer do it and you move on to the next patient. So you miss a lot of things,
Mhm.
but they're all Joint Commission accredited. That's one of the things that goes within Joint Commission accreditation. So it really, both my parents being in the hospital. They're both under Kaiser, but and me just experiencing this, our healthcare system is not functional. Like it's full on preventative. And once it gets to actually being able to do a diagnosis and work on unless you have a lot of money, you're on the very, very, not even like lower high socioeconomic status, like your high socioeconomic status. you're not gonna get the type of medical treatment that you deserve, even though you've been paying for healthcare for years.
Yeah, I feel like there's so much. I think that it sounds like from our conversation to this point, it's only gotten worse in terms of the realizations
Yeah.
and just how pervasive the problem is. And I think it's actually scary to think like it's not just the more you encounter the healthcare system, the more you have to interact with, the more you need from it.
Mhm. Yeah. And as mental health clinicians, like we know how bad the healthcare system and insurance is for mental health. Like I've known that for years. Like, first of all, no therapist wants to go under insurance because they pay you what, $50 for the session and they ask you for 2 hours of paperwork.
Mhm.
Like, and to stay on the phone for an hour every other day to tell them why they deserve to be under care. Um, but then that's the thing where I was like, okay, mental health, it's been an issue. Everyone talks about it. Everyone knows how bad it is. It also affects our homeless situation. It affects everything. But like at least our medical is not bad. And then when you come into that, you're like, oh no, like all around, insurance companies pretty much just get paid. And doctors aren't even respected for their opinions and their suggestions of what the treatment plan should be because unless the insurance doesn't, if the insurance covers it, then they have the freedom to do it. But if insurance doesn't cover it, which they don't because they want to make more money, is the only assumption I can have. I really don't know why they wouldn't cover, especially if that's what their service is supposed to do. Doctors don't have the freedom to do anything.
Yeah, there are so many like I think different aspects of this experience. And I think like it's impossible to make sense of a system that wasn't actually made to support health. And I think it's even, of course, a lot of the things that you're talking about are like it's even more disturbing in the context of like something that's deemed an emergency, but like I don't know, in my definition, in my estimation of emergency isn't what happens doing something in um 2 weeks.
Yeah.
Like, I wouldn't be like if someone was like, "I'm having a mental health crisis," I'd be like, "I could next time I could fit you in is 2 weeks from now. Hope you enjoy your time." Yeah, it's just hard to really even wrap your head around what that is, and I feel like the system that we have, I think we can all say, I think bipartisan kind of support for like the system doesn't work that well. And particularly if you need something. So there's just this like, I don't know, I feel like it's so hard because a lot of what you're talking about is these systemic issues and just being experiencing a microcosm of this like bigger problem. And I think it's so hard to like, I think as we're having the conversation, I think a lot of what came out of it was like trying to, even when we were talking last week, of like trying to get your mother care, but knowing that it's like, even if you get her care, we're still in a broken system.
Yeah.
And I think, and now with your dad, of like, trying to like kind of help support him, get him what he needs, but we're still in a broken system.
And that's the thing, like it's all of it, all of the care that's being provided is against all the recommendations of the medical association, which means at this point, if the medical association says, for example, like my mom, there's thyroid cancer, it has to be removed within 30 days of diagnosis. The hospitals and the doctors are like, well, we don't have the time, we're understaffed, and the company has to approve it, and the insurance company has to approve it. The insurance company doesn't necessarily deem it an emergency because they're saying you can wait a little bit longer. So, the medical association, we're not listening to you. Or same thing with my dad, like being on the life support machine through the mouth, that you're not supposed to be on that more than 14 days. And then after the 17th day, they have the surgery booked for 2 weeks later, which means you're already be like the medical association says you can't have it because it causes infections, it causes mouth sores, and if a person can't breathe already, that infection could kill them. But the insurance company says, see, It's okay if they get an infection. There's medication for that that you'll have to pay for, that we will cover for you. Like, that's the thing where for me, and we've been having this conversation so much in my household because it's like between my mom and Asia, we've been talking about like this is at the end of the day, the richest people actually are the pharmaceuticals who do end up paying for campaigns. They end up paying for all these things. So, unfortunately, in our world, money is more important than humanity. It's just reality.
One of the most disturbing examples, and that's been really kind of sticking with me, is that like new proposition in California about um minimum wage. And looking at like
Which one is this?
it was a proposition that like kind of raised the minimum wage for all people in the service industry, but there was this interesting exception. The exception was restaurants that are also bakeries. And shockingly, it's so crazy to think about, but who fits into that category? Panera Bread.
Mm,
Who does Panera Bread back but our governor? Like, it's just, if you look at the like kind of string of like, how do we reach this exemption? And I think just like the more you know, the worse it gets. And so I think that it's like a similar idea here of like, once you really kind of piece together, like kind of how all these things work together and how they're working to create a system and to maintain a system that's really ineffective. Yeah, I think that's part of it. I've been like kind of stuck on this Panera Bread thing for like a month now. Like since the election, I'm just like, how does that even happen? Like, how do we allow that to happen? And there are just so many things that are like kind of outside our control as like, consumers or like voters of like just all of the ways these things operate together to maintain this system. And so, yeah, I think the people with the power, the people with having enough resources to actually modify our existing infrastructure, don't always have the best interest of humanity.
yeah, and that's it. That's the piece where for me, and this is like you know me, when I come up, when I think of a problem and I'm like, no, no, like this is an unjust and unfair problem. Like everything in my power, everything within me becomes so obsessed with that problem. And I'm like, okay, what are the ways to solve it? Okay, so first thing, because the reality is we do have different types of people. Some people are not as vocal and aggressive in speaking up. Some people are a lot more quiet. They're afraid of confrontation, I guess, is the best way to describe it, right? So, and that's the thing, those people that are afraid of confrontation, if they went through what my family went through, like we talked about it, they wouldn't have lived. They would have just been saying the doctors know what they're talking about, like the insurance knows what they're doing. Let's just wait. Versus like my culture and my family, like Persians, they're known to be feisty and complain and push for things and fight. And even like when it's unfair, it's even more. So in my mind, I'm like, okay, so if we consider two types of humanity, the types that are feisty is the word I'm going to put on it, the types that are like more compliant. Okay. But then you still want people in government or in places that make decisions that are able to be feisty and stand back and say, I don't need your money for my campaign
Mhm.
because your money is going to influence my campaign. And you know what? I just want a campaign, which I think that's the piece. But then again, that makes it very difficult for them because bigger campaigns get a lot more attention, which then they get more votes.
Yes.
So then that's where I'm kind of stuck in like, okay, again, you have 5 ways to solve a problem. Can you change the situation? Can you change the way you feel about it? Can you accept it? Do you want to make things worse or stay miserable? So the two, I'm like, I'm not bordering on it, but if I continue with my thought process for another 3 months, I will be. But I have changed my emotion around it, which I'm like, you know what? Radical acceptance, this is life. But that
Mhm.
doesn't mean I'm just because I'm radically accepting it doesn't mean I'm not gonna try to think what I can do to make a difference. And it doesn't have to be big. It could be one drop in the ocean. That one drop is a ripple effect of change.
Yes. Yes.
But that's the piece where I'm like, okay, where does that drop begin? How does it start? And that's kind of the and I'm so curious. I've been talking to all the nurses while I've been at the hospital, and I'm not kidding. None of them are satisfied. All of
Yeah.
them are overworked, not respected, and one of the doctors literally was like, I'm treated like I'm a nurse, which like I know what that feels like for a doc. It's like I'm treated as someone that like my opinion doesn't matter because at the end of the day, it's the people that didn't get the education that are doing insurance that make the decisions for everybody.
I think it's so sad too that like there's like this accepted like kind of that like it's accepted kind of across the board that nurses are never treated well. And I'm like, and that's our marker is like some people will just never be treated well. And then people who other people like that is their kind of metric or measure of maltreatment. So like kind of a, just apologize to nurses kind of out there, like this is our world.
Seriously, because the reality is they do way more than the doctors too. They deal with the emotions, they deal with the chaos, they deal with the patient's emotions, the family's emotions, the doctor's emotions, the administration's emotions, on top of actually taking care of the patient that's in the unit.
I feel like there's no kind of stone unturned when it comes to like people being treated poorly in like most of our systems, particularly healthcare.
Mhm.
And I think like kind of as we're talking about it, what you're reaching is like, how do I use kind of the acceptance of where things are to facilitate efforts towards change, even if I'm not at the change point?
Yeah.
So I feel like I feel like it's like living in two worlds. It's like I have to actually operate with this system, engage with this system, and at the same time, I have to um I have to figure out a different strategy of like how do I effectuate change in a broken system. And I think just to kind of pull us back into like a conversation about just the conversation that we're having right now. I mean, as we've been talking, like I feel like it's so easy to kind of get trapped in my own hopelessness.
Mm,
And I've definitely noticed that surfacing just kind of as we've been having this conversation over the past couple of weeks is like, yeah, I feel my own hopelessness. And does that dictate? And I'm sure that's dictating, I think, how I'm approaching this of like, well, what could we really do of like kind of having those thoughts? And I just wanted to kind of question, like, how are you kind of what's coming up for you as we're talking about this? For me, it's hopelessness.
yeah. It is for me hopelessness too, but I think for me, I do when I feel hopeless, like I do a couple of things to cope with it. So one is being able to practice gratitude in the midst of hopelessness, right? So one of the things that I have been doing and like using the comparison skill of being like, okay, if I lived in a different country, like lived in Iran, yeah, their doctors and their medical system, like treating patients is so much better because they don't have this whole concept of like pharmacy. They do, but it's not in the same exact way. People can go and pay for their doctors and they get amazing care. But on the other end, they lack freedom, they lack all these other things. If I compare it with Sweden, where one of my best friend lives in Sweden, they're like, she had an issue, a health issue that kept for 2 years. They weren't treating it because it was an emergency enough until it started leading to suicidal thoughts. Like her health issue actually led to suicidal thoughts, which that's where I was like, enough is enough. Just fucking pay private and go get your health done. So like I compare to other places and I'm like, okay, like I can practice a tad bit of gratitude that I live in America, and I love where I live. I love that I have multicultures. I love growing personally. I love growing up in a school where I had African American, Chinese, Korean, Persian, Armenian, Irish, people like Native American, people that didn't even know where they were from because they've been here for so long. Like, I love that. But then I come back and I'm like, this is not, just because I love this country doesn't mean I'm willing to accept the flaws. And I know it's never going to be perfect. And I expect to be taken care of because I am someone that grew up here and lived here. I've paid for taxes. My children are going to grow up here. And I'm not interested in becoming Iran. I'm not interested in becoming Russia. I'm not interested in becoming any other country but the country I've been the past 30 years. A free country that's taken care of their people to an extent, but in the past 15 years, we've become so much more money based than we ever have been. And so a part of me is hopeless, and a part of me is just educating myself and talking to people, trying to figure out a way that maybe not now, but I want to think of how I can influence a change in the way this country is, because I genuinely love this country too much to start feeling hopeless living in it.
I feel like for you, I think it's like it's an indicator light. It's become like an indicator light of like something else has to happen. And I think that's where the helplessness becomes effective. And I think mine is still in that ineffective place of like, yeah, it's pretty bad out here, but I don't really know if we have a lot to do to change it. A lot of options here. So I can definitely, yeah, I definitely think that's the important kind of other side is to like to point that out of like, we can identify hopelessness, we can feel hopelessness, but it doesn't have to mean that there isn't, it doesn't have to be against change or possibility. And so I think as we come like to a close of this conversation is just being able to have that mindfulness of like kind of what's happening to us as we go through this.
Yeah. Yeah. Radically accepting the hopelessness, because that's obviously it's a very valid emotion to experience. Um, and reminding yourself that you might not know the answer now, but there is an answer somewhere. And
Yes.
patiently wait until you think of it. That's the conversation for today. Well, thank you for checking in with me. I'm actually really glad I got to let some of this out of my chest, because every single day I've been talking about it with my mom and Adrian, and I'm like, this is ridiculous.
Right.
What is this?
It
What?
is.
Well, happy Thursday, everybody. We hope that if you guys have any comments about this topic, genuinely feel free to write in there. If you have anything that you want to add, like as you're listening to us, you're saying things to yourself, add it in the comments. We would love to hear it. If there's a topic you want to bring up, add yourself in there. We can bring you onto our show for a conversation.
Absolutely. If you think the healthcare system is going well, also let us know. Just
Yeah,
kidding.
if you're on the other end of the
Yeah.
dialect, let us know.
Yeah.
We are hopeless here. Happy Thursday.
Happy Thursday.
Bye.